Draft of their health care bill today after weeks of working on it in secret. We're going to talk about what's in the bill coming up in our next half hour. First, we're going to talk about the process in this week's edition of Left Hook, Right Jab. And joining me now are former Portland City Commissioner Steve Novick and KXL's Lars Larson. Welcome, gentlemen. Great to have you here.
Good evening.
And this is your question for tonight. Should Senate Majority Leader Mitch McConnell have been more transparent when drafting this health care bill? And Lars, you're up first. Ready?
Well, Laurel, the Democrats were invited into the process and they said no. Kind of a reverse of when President Obama was pushing Obamacare and he said no to allowing the Republicans in. The Republicans have invited the Democrats in. They don't want anything to do with it. Obamacare has been a disaster for America. It costs too much. The premiums are too high. The deductibles are too high, and it's making an awful lot of Americans suffer. It should be repealed. This thing doesn't go far enough, but at least it's a good start, Steve.
Well, Lars, actually, there were months of public hearings on Obamacare and lengthy debate. But on transparency on this bill, it's been very transparent for rich people. They've known all along they're going to get a big tax rake. It hasn't been very transparent for the family with a grandmother who they are worried is going to need nursing home care. They deserve a chance to know that Medicaid helps pay for nursing home care, pays for most nursing home care, and this bill cuts Medicaid. It hasn't been very transparent for a family that's planning to have a baby and worrying if their insurance will cover it. They deserve a chance to learn that this bill says insurance doesn't have to cover childbirth. It hasn't been very transparent for families that can't afford to pay high deductibles. They deserve a chance to learn that this bill says that they'll no longer get the help that Obamacare gave in paying deductibles. So they deserve a chance to hear about that, and the Senate should hear from all those kind of families before they rush through and pass this bill with no debate.
You know, Steve, I got to tell you something. I know usually when Democrats talk about choice, they mean killing babies. I think Americans should have choice. Choose the kind of health care that's appropriate for you. My 70-year-old mother-in-law does not need maternity care, but Obamacare mandates that she has to have it and she has to pay for it. That's ridiculous. We need to give choice back to Americans and bring the private sector back in. Right now, we have American insurance companies that are fleeing from the Obamacare market. If we don't repeal this thing and put in something sensible, you're going to have entire sections of the country that have no insurance provider at all.
You know, Obamacare has flaws. It didn't do enough to control costs, but it did give people help in paying those costs. This bill does nothing to control costs. To do that, they would have had to do things like taking on the drug companies, which Donald Trump said that he would do, and now he's crawled into bed with them. All this bill does is eliminate the help that people were getting to help pay the cost in our ridiculous American healthcare system, which actually should be replaced by a Medicare for All system like Australia has.
Steve, I love how you talk about help. You mean the help that a family making $98,000 a year gets a subsidy from the American taxpayers to pay for their health care. A family of four at $100,000 a year in household income should be paying for its own health insurance. More competition and allowing sales across state lines would absolutely help to fix this problem. Obamacare is a disaster. We can't allow it to continue 1 minute more.
This is supposed to replace Obamacare. The question is, does it just make things worse, which it does? And it's interesting. You're concerned about welfare for the rich, but you think it's perfectly okay for rich people who make their money buying and selling stock not to have to pay Medicare taxes, which all the rest of us do on our income.
That's all the time you have, gentlemen. Nice job. We'll see you next week.
Thanks, Laurel.
Left Hook, Right Jab. Tracy and Joe.
It's just a shame.